clinical practice in Glastonbury, but I'm also the co-chair of the Legislative Committee for the Connecticut Academy of Physician Assistants. And good afternoon, Senator Gerentano, Representative Ritter, and other members of the Public Health Committee. Connecticut Academy of Physician Assistants, which is CONAPA, the professional society representing over 900 physician assistants in Connecticut, submits this testimony recommending the inclusion of the title physician assistant in most instances where the title advanced practice registered nurse is also added to raised bill 67. By excluding PAs by title, Senate Bill 67 will negatively impact current PA practice in Connecticut and Connecticut's residents' access to health care by PAs. Connecticut PAs practice medicine with nearly identical clinical roles and responsibilities as APRNs, and often with APRNs as colleagues in the same clinic, hospital, or other health care facility. Along with our physician colleagues, PAs and APRNs' practice authority and responsibilities are exercised not only in primary care settings, but also in many other settings, including urgent care, emergency care, specialty care, clinics from orthopedics to oncology, hospital-based medicine units, intensive care units, and specialty intensive care units. Very simply, if SB 67 is approved as it is currently proposed, the exclusion of PAs will create significant confusion regarding existing PA scope of practice, subsequently undermine current PA authority as care providers, and ultimately decrease access to care by Connecticut residents. Connecticut PAs and patients have experienced this unfortunate fallout of exclusionary statutory language due to exact interpretation of statute by healthcare facilities or institutions that employ PAs. To that end, CONAPA respectfully seeks most precise and accurate language that includes physician assistants within SB 67. The places requested for inclusion do not change current PA scope of practice, as CONAPA does not seek authorization to certify the use of medical marijuana. CONAPA's goal is merely to more formally synchronize Connecticut statute with current PA practice and avoid creating more confusion that may unnecessarily prohibit PAs from providing the highest quality of health care to Connecticut residents. Thank you for your time and consideration.
Thank you. And did you submit your testimony electronically?
No, I think we have it.
Okay. Just please give it to staff so we can get it there. Thank you very much. Any questions from the committee?
Yes.
Seeing none, thank you very much. Oh, I'm sorry, Representative Srinivasan.
Thank you, Mr. Chair. Good afternoon, Dan. Good to see you here. Good to see you again.
Thank you very much.
And thank you for coming here this afternoon. So that gets us clear. So in this Bill 67 that we're talking about, Senate Bill 67, where we are giving authorities similar to an MD to the APRNs. And obviously we're going to go section by section as we've heard this conversation already, and then decide what all we're going to agree upon and what is up for discussion. So if I understand you clearly, without impacting scope of practice, because you did mention that the thought crossed my mind right off the bat, but you're saying by the including the physician's assistants in this conversation, in this dialogue, will have no impact as far as scope of practice is concerned as to what a physician assistant does.
That's right. In every state, including Connecticut, physicians are permitted, within that healthcare team to delegate responsibilities to PAs. And in this situation, there's only one thing I can think of statutorily that physicians may not delegate, and that's the certifying of medical marijuana by PAs. I believe that's excluded from the ability for physicians within that healthcare team to delegate. So PAs and CONAPA are not seeking to change that role. In the situation, by including PAs, it's preventing confusion, because as of right now, there are three types and groups of healthcare providers within the state of Connecticut. If we write language in the statutes that say a physician, a APRN, may do something, and you exclude PAs in that language, it will be interpreted, and has been interpreted in the past, by those that are creating groups or in healthcare facilities, thinking that your intent is to exclude PAs from that role, from that function. As of right now, PAs are providing these functions that are being asked for in this bill. By not including PAs, it will look as though your intent is to exclude PAs from providing the role which we are providing right now within that healthcare team.
Thank you for that explanation. But the difference in the two situations between the PA and the APRN is APRNs now have the independent practices if they choose to do so, and PAs cannot.
Yes.
And so, given the fact that there's a difference between, yes, you're absolutely right. Many practices have in that practice an APRN and a PA, including mine. So I see that, but even given the fact that the PAs cannot practice independently, you still feel that they need to be included in this conversation and in this piece of legislation.
We do. We feel that if it's not included, it looks like there's an exclusion. My sense is that if we include PAs, it does not, it will not increase that scope because PAs will still be working within that healthcare team. APRNs may work within that healthcare team or they may not. And so what's being stated in this inclusion of APRNs is that they can provide this service, they can provide that particular function, and it does not have to be provided within that healthcare team. PAs were not looking to remove that inclusion within the healthcare team, however, but it still will be looking like we cannot provide that service if PAs are not included in this language.
Thank you, Dan. Thank you, Mr. Chair.